Hi everybody. Want to come back to you and talk about the HQ challenge number 17, a little bit of patient assessment going on here. So we have a post-op cholecystectomy patient that has fine late inspiratory crackles in the lower lobe. Okay, so first of all, let's remember where the lower lobes are. They're predominantly on the back, right? So they have fine late inspiratory crackles in the lower lobes. So this is very indicative of atelectasis, and so you hear that snap, crackle, and popping as the alveoli open, okay, late inspiration. Which of the following therapies would you suggest? Well, if they have atelectasis, we need to incorporate some form of hyperinflation therapy, and as we come down here, the only one of these that does hyperinflation or alveolar re-expansion would be IS therapy, okay? This patient doesn't need a bronchodilator. If they did, they would be wheezy. They don't need CPT. If they needed CPT, that would be evidenced by retained secretions, which would be breath sounds that were probably more diminished or maybe a little bronchial. And then oxygen therapy, there's nothing about this breath sound that indicates hypoxemia or an increased cardiopulmonary workload. So definitely need to start IS therapy on this patient. And then the next question is, upon performing the previous chosen therapy, which was IS, the patient complains of dizziness and numbness in the extremities. Which of the following would be recommended? So dizziness and numbness is characteristic of hyperventilation. Okay, the patient's just performing the maneuvers too fast and they're blowing off CO2. All right, so we got to get them slowed down. So encourage the patient to perform each breath more slowly because it's a slow, deep breath, a sustained maximum inspiratory maneuver, and rest between each of those maneuvers. This is the answer. All right. The patient doesn't need to be on 100% oxygen assessing for a pneumothorax. If a pneumothorax had developed, they would have complained of sudden chest pain while doing this. Asking for pain medication, that's probably not a good idea because we're supposed to do IS every hour and you really can't have pain medicine that often. And then there is nothing in the scenario that indicates that the patient needs oxygen therapy. They're just breathing too fast. So hope this helps. See you soon.